All right, the meeting recording has started, so let's call it to order. And I suppose we have to take a roll first, right?
Yep.
So Joe Tennyson, present.
Jim Goodman,
Present.
Robin Williams,
Present.
John Garside.
Here.
All right, and Tina's here, and our guest Michelle.
Here.
Okay. So first item would be reviewing the minutes, which I am just kind of scrolling through here, and they look fine to me. So if everybody has had an opportunity to review them, I will go ahead and make a motion to accept them.
I'll second the motion.
Roll call vote, Joe,
Yes.
Jim,
Yes.
Robin,
Yes.
thank you very much.
I have no hammer to bang on the desk. Sorry, gavel, that's it. All right.
There you go.
All right, new business. So we have a new public health nurse.
Yes. So we're excited to have Michelle on board. As you know, it's kind of been a long search. Michelle's worked with us since March 15th or thereabouts when the school nurses came over to help us out. So we're excited to have her on board, and I'll ask her to introduce herself if that's appropriate, Mr. Chairman.
Absolutely.
Hi, my name is Michelle. I am excited to start this new position here at the Board of Health. I have been a nurse for a few years now over at Marlborough Hospital for about 10 years altogether. I worked at Hildreth for a little bit until I came over onto the Board of Health in March. I've been dealing mainly with the COVID stuff, and then just recently doing some of the park inspections and doing some TB cases and also Lyme. So I've been slowly getting my foot in the door here. So I'm excited to start.
Welcome.
Thank you.
All right. Moving on from that, John, what do you got about this COVID thing?
This COVID thing, I'll just run through some numbers, latest and greatest numbers. So since February, we've had 1,043 cases in the city. 948 of those folks have recovered, 66 have passed away, and we currently have 29 active cases, 2 of which are in long-term care facilities or assisted living facilities. We're averaging 2.3 cases a day over the last 7 days, which is up just a little bit from a month ago when we had our low of 0.57 cases per day over a 7-day period, the second week of July. So just trickling up a little bit. I think we're doing well considering, but always keeping our eye open for any type of trends. We really haven't had much of clusters to speak of. I mean, we start a cluster if we see something in a school. We had summer school. We had a case pop up in summer school. We start one if it pops up in a daycare or day camp, but we really haven't seen clusters that develop more than 1 or potentially 2 together. So I think we're fortunate in that regard. Over the last 2 weeks, which is a time frame that DPH likes to use commonly now, we've had 2.56% of the tests performed on Marlborough residents were positive, whereas the state's percent positivity in that same time period is 1.7%. So we're a little bit above the state's overall positivity number there. Stop the Spread, our free testing program at 3 locations in the city, as you folks know, has had a 0.72% positivity rate since its inception 3 weeks ago. And we would suspect that to be lower, whereas those folks are oftentimes asymptomatic and just really want a test to know or a test to travel. So that is significantly lower than the state average as well as our average positivity. Stop the Spread is scheduled to run through August 14th in the city. and in the other original 8 communities, and I think there was 8 others that started a week or so ago. So they're still holding that 14th date as an end date as of our conference call on Thursday and Friday. So it'll be interesting to see if that moves or develops, but that's the line in the sand as of now. That's kind of it for me on COVID.
So as I look at the state's daily report from today, the percentage of molecular tests, so the PCR tests that were positive for today's data is 7%, but the N looks like it's only 15. So this is probably just very early data, and it may settle out because it has been very solidly right around 2% for a while. There is a website I've been looking at recently just to kind of track how things are going called it's called RT Live, and it gives you an updated reproductive rate for the virus, for the infections. And Massachusetts remains over 1 and has been now since June 15th or 16th. It's wiggled up and down a little bit, but they're still listing us as an RT rate of 1.11. That is not how you make an epidemic or pandemic go away. That's how it persists. We need the number to be less than 1 for it to go away. On the bright side, the number of states that are listed as having a reproductive rate less than 1 seems to be growing. But some of the states are like out of control. Hawaii has a 1.31 rate, very high. So I'm very concerned about the fact that we're going to start seeing new growth in the case rate.
Tina and I were looking at that website, I believe, last week, and there were some states that didn't make complete sense on there at the time. Do you see some of that too? I don't know if we were looking at some of the Floridas and Arizonas of the world. It didn't seem like their RT rate is falling in line with what you might suspect.
Well, look at ours. So if you look at Massachusetts, and our peak infection rate was mid to late April, right? So around April 20th or so was when we had the highest new case rate. The RT rate at that time was about 0.85 on this graph. And it's because as there's a higher infection rate, people are doing less going out. They're more aware. They're using their PPE more appropriately. They're staying in. So states where incidence rate is high and everybody knows it, it's all over the news.
Yeah.
They're actually transmitting less because people are staying in. And because we see the actual incubation rate for this is still kind of unclear, and it varies a lot person to person, but it can be a few days to a week or so before people show symptoms. But it's generally from the onset of symptoms to the onset of hospitalization is 7 to 10 days for those that get really, really sick. So we see whatever the incubation rate is, plus the 7 to 10 days is the length of time from the time somebody gets exposed to the time they're showing up on everybody's statistics and being hospitalized. So when it's really, really bad out there all around you, the RT rate goes down because you're actually infecting fewer people because there's less exposure. Whereas Massachusetts, we're all feeling nice and happy about our reopening and going out to restaurants. Guilty. And I think that we're running into a lot more opportunities for exposure, so we're going to see continued growth. Now, will this take off to where it was with a completely uninoculated population? Will there be some degree of herd immunity? I don't think we've had enough exposures to expect that. It all completely remains to be seen.
Okay. Anything else on COVID that anyone else wants to share, add? Or?
The deaths, you said 66, I think, for the city.
Yeah.
Do we know what proportion of those were long-term care residents?
Yeah, it was.
Because I think it was really high. But
Yeah, it was probably 55, if I had to guess. That's all right, Tina?
Yeah, I think it could be even higher. I
Yeah.
can get that for you.
Yeah, we've had that. We just don't have it at our fingertips, but it's high.
okay, so a fairly minimal impact to the general population and a higher impact to the really sick and infirmed.
Yeah.
Much.
I think it was 7 out of, at the time, it was probably, low 60s were the death total. I think there was 7 of them, if I remember correctly, that weren't in long-term care.
Okay.
So, yeah. And just it's kind of a little bit out of order, but I'm working with the public school systems as well as Assabet and AMSA and soon to be Hillside, formulating a back to school plan with those folks. As you know, they're trying to get their wheels back on to go back to school. So we've set up weekly meetings with the public school system here to coordinate with them, and working with Assabet as well, and we will be working with the other 2 schools, although I heard AMSA through the grapevine might be remote, whereas say Assabet and Marlborough Public Schools seem to be looking at a hybrid model of back to school. So the remote will certainly be easier from our standpoint, but
Well, from a public health standpoint, I 100% support remote, but I'm very worried about the folks who do not have adequate bandwidth, internet access, computing support. There's going to be a lot of kids who don't get appropriate education if we keep them out of the schools.
Sure.
And how do we find that medium? I have no answer to this question. It's just, it's what scares me, because it's easy for us to say, yep, absolutely, you shouldn't be back because, our kids have laptops they can use and we've got broadband internet in our homes. But there's a lot of families out there that don't, and a lot in the city that don't. And that worries me a lot about how we maintain that. And I am absolutely sure that the superintendent's all over that problem.
yeah. Okay.
Robin has.
So we had the Coalition for Local Public Health had a meeting today. And as you know, well, I don't know if you know, but Massachusetts Health Boards, their association is part of the coalition. So we attended all that training, Cheryl Spara. They're talking about putting on a seminar for health boards to talk about some of the back to school issues and how some of the DESE protocols kind of contradict some of the public health protocols. So I didn't know if you guys might be interested in something like that. It's still being developed, but they want to bring on more health boards to kind of hear what the conversations are taking place with all these back to schools, because there's so many different opinions.
Well, I think, like Robin said, what we're going to run up against is there's certainly different guidance that DESE puts out versus the public health guidance. We've wrestled with that over the last couple of weeks. Even stuff as one might think as basic as, quarantine requirements. They're allowing folks to be tested and come back to school, say, versus the quarantine of 14 days, regardless of the test after an exposure. So. But on the same hand, I think ultimately we're going to be left with, it's going to be a local decision, if we see these incidents of COVID in the schools, how much is too much? And, almost like with the EEE, that it's going to be a local decision. So any guidance we can get, we certainly welcome. But I think the reality is they're going to lay out what, here's the situations, but then ultimately they're going to cast it back to us. I mean, Robin, I think you make a good point that we're going to be the decision makers, right? Like always.
And so that's why I bring it up. It's more of all of us being on the same page as public health officials and boards to kind of voice, our opinions and to kind of come together, because yes, it is up to each municipality. But there's so many different conversations that are taking place. So it's just something that, again, I'm just letting you know, being kind of the messenger, that there's a lot of stuff taking place behind the scenes.
Yeah, and it would be so nice if it was all in a nice, pretty package 2 weeks ago, right? But not quite. So stay tuned as that stuff develops. That's for sure, because we're always looking for it. So I think it'll be great if there was guidance there.
Yeah. There's one other thing that we're experiencing. So we just finally, Wednesday is going to be our first testing site in Framingham. So Sam finally approached all the politicians, the Republicans, and they finally agreed to have Framingham as one of the test sites. So that'll start Wednesday until the 15th, free testing. So if people need to go and get tested, there's another opportunity. It's at Keith Tech on Winter Street. But we're seeing a lot of cases right now of positive parents and children being in daycares. We have at least 4 or 5 over the last week. So I'm not sure if we're starting to see that in Marlborough, but it's huge in Framingham right now.
Yeah, I wouldn't say huge. I think we had a couple daycares over the last, few weeks that went positive, but certainly one of those things we always watch and worry about. Regarding the Stop the Spread, if I could, the numbers on Stop the Spread are, so in the Marlborough 3 locations, they've done 6,644 tests. Kind of the downside of that is we don't know how, from our perspective locally, if you will, we don't know how many of those folks are Marlborough residents, and nobody seems to truly be able to quantify that. We did have the hospital give us a snapshot, I think it was week 1, and they thought 30% of the Stop the Spread folks coming through their door or their window was 30%. So they're putting together some numbers and have promised us some numbers by tomorrow, just to give us a feel for how many of these folks are Marlborough that are going to Stop the Spread in Marlborough. So that would be interesting, but my sense is personally it's probably lower than the 30%, but we'll wait and see. But some of the state numbers, they try to give us something meaningful, but they're not always very meaningful. So it's hard for us to quantify it much further than that right now. What else?
Okay, what's next?
I'll just give a quick update on a couple other things, if I may, Mr. Chair. The Triple E and West Nile virus, we're in the low risk for both of those, which is good, I guess. Stay tuned as that season develops. Regarding Triple E, they have found positive mosquitoes in Plymouth and Franklin counties. West Nile virus in Middlesex, Suffolk, Norfolk, and Plymouth counties. And a case of Triple E in Plymouth County just recently as well. We are evaluating our flu clinic options as we go forward into the fall here. Is it appropriate to have in-person flu clinics and the such? Certainly not the old-fashioned way where you'd storm the gate and get in line, get there early to beat the rush and cause the rush. So we're looking at perhaps a drive-through option, and we've reached out to a local provider to talk a little bit about doing drive-through flu clinics. And if we had to supplement that with, more local, appointment type clinics, that's probably the way to go. But stay tuned for updates on that as the weeks go by here. We're just kind of pulling that together and looking for what makes the most sense for us in that regard. I think that's all I have for really updates. I do have the one item I sent to you folks regarding really under subdivision site plan special permit reviews. which was that Veolia. If you want to get into that, Mr. Chairman, we can.
Absolutely.
So Veolia Environmental, I sent that out in your packet, that they're requesting a general permit from the Department of Environmental Protection for a proposed recycling activity. This activity would take place in the town of Northborough, arguably, although a corner of their building is in Marlborough and their frontage is in Marlborough. So they have a Marlborough address. So they notified both the local boards of health that this application was being sent to the Department of Environmental Protection, and we've corresponded with them over the phone, as well as the folks at DEP regarding it. I'll just read a little bit from the cover letter real quick. The proposed activity will be done in a totally enclosed area at all times. All operations will be conducted inside a building or vehicle. The materials would only include recyclable materials such as scrap metal, television sets, computers, electronics, light bulbs, containerized plastics, containerized glass. There would not be any processing, destruction, crushing, melting, etc. of these materials at the office location or warehouse. These materials would simply be collected and sent to a third-party recycler where they would be processed. So what they're doing now is these materials are coming in on a truck and staying on the truck till the next day or a few days, then being shipped out to somewhere in New York, upstate, I think, for processing. So this application would allow them to take that material and keep it on site for a period of days or arguably weeks until they had a full container to then in turn ship it. So they get to handle it one time versus not handling it all just on the truck and then shipping that same truck out to Schenectady or wherever that typical processor was. So that's why they're here today, or this is before you this evening, their application. And I enclosed some photos of the site as well. Typical tractor trailer box trucks parked at the back of this facility. And we're not talking a big volume, according to these guys. Really, it's not. I mean, arguably in this permit, just reading from the regulation. So what they're looking for is a general permit, and it does not require site assignment. So site assignment is what the Board of Health would do if there was a landfill or a transfer station being proposed in town. We would be the permitting authority along with DEP, but certainly site assignment is a Board of Health issuance or authority regarding site assignment. So it's not that, it's a much lesser general permit, as they call it, for recycling operations. The caveat here in the regulation is no more than 250 tons per day of recyclable materials. And after conversation with these folks, it's not, that's not anything near what they propose to do. There's really only, a truck or two hauling out of there a day, tractor trailer, say, maybe even per week as you talk to them about it. So I think given where they're located and they've been operating out of there, I personally think it's probably a pretty good use for a facility like this. And I guess if folks had no questions or comments, I think ultimately we should provide some type of motion that to the effect of, we're not opposed to the issuance if DEP warrants it appropriate. And I have had this applicant check with the zoning folks upstairs in regards to, is there any other requirement? Do they meet zoning? Is there any other special permit requirements from the zoning board? Or such. And his initial read was, I hate to speak for him, but his initial read as of last week was he didn't think so, but he was waiting to kind of formally read some of these submissions before he made a formal determination. But I think probably independent of anything we do, but I just wanted to make sure that we advise the applicant and the other boards and committees that you needed to meet zoning and any special permit requirements if they in fact exist.
So as I understand it, one, it's almost entirely happening in Northborough, not Marlborough. Two, they're not actually processing anything. All we're really giving is a permit to store stuff.
And not even a permit, where DEP would issue the permit, we're really just, we're notified of such, yeah.
Okay. Does anybody have any issue, anything that I'm not thinking of that bothers anybody else?
I was under the impression that this was more of a courtesy type thing they were bringing to our attention, and we didn't actually have to vote. Did I read that incorrectly?
I think you're right. I think, I mean, never hurts to vote. I mean, I can certainly, the reality is, some boards may administratively handle this with a review by the director if it's, light lifting sake. But I just wanted to throw it at you folks so you were aware. I would bring your comments back to him regardless of what form they go in, a motion or not. But I'd bring your comments back to the applicant and DEP.
And so, John, this wouldn't be, there wouldn't be any potential of having any kind of rodent activity or anything. There's no like food kinds of things or anything like that.
No, and I think, the only thing that, I'm not 100% sure about in that regard is they talk about these containers, containerized glass, containerized plastics. In their application, it's explicitly, I can actually read it to you for what it's worth. It says, but here's the regulation, but their application says the same stuff. Talks about creating a nuisance right here. So ensure the operation handles recyclable materials and residuals only within a handling area, containers or trucks that are sufficiently enclosed and covered to prevent a public nuisance. So it's going to be in their warehouse or in, closed containers, i.e. tractor trailer trucks, I would suggest, if they are in the parking lot. But we certainly could comment that, right, that if there's any residuals that would draw pests, right, that there's.
Yeah, we don't want any rats in our city.
Right. And I think I might, I did, when I talked to him, I said, you folks are modifying your contingency plans, whereas you are handling something now, whereas you weren't handling it this additional time. And he indicated, they were, so we could perhaps put that suggestion out there that we trust that their contingency plans will be modified to incorporate the modified operations, including including rodent control if required.
Do we know if Northborough had any concerns?
I have not talked to those folks, so I do not. But I do know they reached out to him from talking to both the DEP representative named Penny, Michael Penny, and the applicant themselves. I always say the good thing, like when I think of operations like this, anything coming through town, and you have to bet, even if it's in the yard over there, it's not, it's nothing like a transfer station or, where or even the organic, the organic composting can cause a nuisance too, right? Versus some of this stuff. So I think from a neighborhood standpoint, it's in a good neighborhood, and I don't think this type of operation would create, I don't think you'd know they're there.
And the application that you're referring to was not an application they presented to us. That was an application they presented to the state, correct?
Correct.
Okay.
Well, I have no particular problem or issue with it. I don't know if we need, I don't know that we need a vote to say so, just, I think if we note in the minutes that it was reviewed and there were no objections or concerns, because I'm not sure what all we'd actually be voting on.
All right,
I agree.
I'll just forward the couple comments we had to the applicant and the Department of Environmental Protection, if that's appropriate.
Sounds good.
Fine.
Next.
I think that's all I have. Set another meeting, I guess.
I just was scrolling through the sanitarian reports. It looks like there's a few restaurants that have been behaving badly around masks.
Yeah, I mean, I kind of anticipate those. But we have some repeat offenders, arguably, I guess.
Any other significant
I'm sorry, Doctor, you broke up there.
a Burger King ice cream machine complaint of some sort?
Oh, I think that was, if you could mute if you're not talking, that might help whoever's, yeah, I think the shake machine would be a high coliform or total plate count at Burger King. So when that happens, they shut the machine down and retest. So I think that might be what you're referencing, Doctor.
So it wasn't a complaint so much as just something found on an inspection.
Yeah, we get notification via email from the laboratories when they test them on a monthly basis.
All right.
So when they come back high, we follow up that way.
Okay. Didn't look like there were any other significant issues in there.
No, I mean, it's still, I mean, maybe Robin can help us too with, it's still the COVID thing. Like, I don't know how it is over there, Robin, but, you know, just when you think you get a breath where you go, you know, all right, what else can we focus on? It makes, you know, something happens, right? And it becomes an emergency, even if it's a little thing. Just a case of COVID in a daycare, right, becomes a big deal, right? A case of COVID at a camp, or, you know, one case, it becomes boom, boom, boom. So, and then even just the complaints that come in for the mask or someone not socially distancing. So it becomes, it's always running, if not in the foreground, in the background, right? Which I'm sure for all of us, it's like that. But
You get to breathe?
well, yeah.
Yeah, it's been crazy.
So we'll see back to school, right? I'm going to try to grab a day or two between, like, down the middle of August, you know, because I know back to school, once back to school comes, right, it's going to be, stay tuned for interesting times, right?
So John, when you take a vacation, is there somebody that kind of oversees things? Even when you're, really? You need to take some time for yourself.
Yeah, I know. And you know what? It's funny you asked that, or say that, because when I was going away on, what was that? That was third week of July. You know, it seemed like forever ago now, but it wasn't that long ago. The, you know, quite realistically, you know, Tina was she pulled together the Stop the Spread. It was the first week of Stop the Spread. And, you know, and if Tina doesn't, A, she knows when to call me if need be, even on vacation. B, she knows who to call generally, right? If it's not me, who to get some answers if she doesn't know. So I did say to Tina at that time, this would be the perfect case for a deputy. I think for the week, I promoted her to deputy director. That's how we rolled there. But
I will vote that one.
Yeah, I just said that we had one of our sanitarians had a 6-month anniversary, I guess, just today. And, you know, we kind of celebrated that a little bit. And I apologized to him a little bit for the craziness that is the office. And, you know, but thanked him for his help so far. And at the same time, you know, we have 2 sanitarians, you know, although young, they've been, you know, quick to pick it up. We have Michelle on board now. Tina got her little, just enough so she won't quit, raise back a month or so ago. So hopefully, you know, if we can muscle through the COVID stuff over the next, whatever it is here. We'll be in pretty good shape.
All right. Looking forward toward next month. The first Monday is Labor Day, so let's not do that.
Right.
Not that I'm not working from 6 a.m. to 2 p.m. that day. But how about Monday the 14th? Is that okay with everybody?
That's fine.
Yep. Works for me.
All right.
You are electronically penciled in.
Very good.
Are we waiting for a motion to adjourn?
Yep.
My favorite.
I'll make it.
Second.
I third it.
Okay. Roll call. Joe?
Yes. Oh, I'm sorry.
Was that a Joe or a Jim?
Joe. Sorry.
Yes.
Jim Griffin?
Yes.
Robin Williams?
Yes.
All right, and we'll, for the foreseeable future, that will be an electronic meeting again. We'll see when we get to the point that we can do things in person. But
Yeah, I mean, arguably, we probably could meet just the board. I wouldn't want to drag any public in. But maybe this is good at least through September, right? See how things go.
I want to see what happens as numbers, and especially September as we start opening schools and stuff.
Yeah.
One thing the Department of Public Health shouldn't be, or Department of Health shouldn't be, is on the front end of that.
Right. Yeah.
Agreed.
All right, well, thank you all.
Thanks, guys.
All righty.
Everyone, take
Yeah.
care.